And today we're going to hear, at the very outset, from Professor Samuel So, who comes to us from Stanford, and who has been a mover and a shaker. He actually has the title, not of mover and shaker, he is a Asia game changer, honored by the Asia Society. And he has a tremendous research record. He's one of the pioneers in multi-organ transplants. And he created this nonprofit organization that has changed not just 5 lives, not just 10 lives, hundreds of thousands of lives. What would you pay for better health? I know, you're Americans, you pay almost anything. Not everybody can do that. In fact, we can't even do it. But Professor So has been working with others to make healthcare in specifically targeted areas having to do with liver diseases and things like that more readily available. He is a real star in the US-China relationship. I feel really privileged now to hear him. I hope you'll join us in welcoming him.
Thank you. So I'd like to thank 1990 for inviting me to come and talk to you. So what I like to do in the next hour is share with you my journey to address a major neglected public health problem which affect Asians and especially Chinese in both in China as well as in the US. And I hope I would inspire some of you to also join in this fight to eliminate liver cancer and hepatitis B in the Asian community. So many of you know about HIV, but a lot of you may not know much about hepatitis B. Actually, hepatitis B affects 7 times more people than HIV in the world. It affects about 260 million people, and every year, because of a lack of treatment and lack of awareness, as many as about 900,000 people die every year from liver cancer or liver cirrhosis caused by hepatitis B. It's one of the major neglected public health problems in the world. And if nothing is done in the next couple of years, the WHO project that more people will die each year from hepatitis B-related liver disease and liver cancer than HIV. And you can see because of a lot of attention in the last decade on malaria, TB, and HIV, you can see deaths from those diseases has continued to drop, whereas deaths from hepatitis, especially hepatitis B and C, has continued to increase. But we can put an end to this. This slide shows the burden of hepatitis B in the world. You can see that just in Asia accounts for about almost 2/3, over 60% of the burden of chronic hepatitis B in the world. And if you combine that with Africa, almost 85% of the hepatitis B in the world is associated with people living in Asia and in Africa. So what is hepatitis B? Hepatitis B is a virus which can infect the liver, and the hepatitis B virus is very smart. It doesn't kill you right away. It uses your liver to make baby virus, and then it spread from liver cells to liver cells. And currently, there's no cure for hepatitis B. There are treatments to control it, but there's no cure. It was discovered by Professor Blumberg, the person in the middle of this picture, about 50 years ago. And he discovered it accidentally from blood from the indigenous population in Australia. So the initial blood test for hepatitis B was called the Australian antigen test. Because of this discovery and the subsequent development of the hepatitis B vaccine, about 50 years ago, he received a Nobel Prize for medicine for his discovery. The hepatitis B virus may well be the oldest virus known to infect man. A study published last year in Nature suggests it is between 8,500 to 20,000 years old. And it has been discovered in mummified children, both in South Korea as well as in Italy. So how is it transmitted? It's transmitted just like HIV, mainly in 3 ways. From mother to child at birth, and that's the major way most people in Asia become infected. Most of them became infected before they even turned 1 or 2 years of age because their mother carried the virus, and the newborn did not get vaccinated within 24 hours after birth. The other way it could be transmitted is unprotected sex and through unsafe injection or injecting drug use. Hepatitis B is not transmitted by casual contact. There's a lot of misconception about how hepatitis B is transmitted in Asia, and it is a major cause of discrimination. Because many people in Asia to this day still believe you can get infected by sharing food. Like if you go to a Chinese banquet and you eat family style, it's not by sharing food. It's not by sharing eating utensils, so you don't need to bring your own chopsticks to China. Okay. It's not by shaking hands. It's not by kissing or sneezing. It's not transmitted by mosquitoes. So, when I created this slide many years ago, it was very difficult to find pictures on internet of Asians kissing. So I asked my student interns from Stanford, could you find me could you find me a picture? So they went back to their dorm and next day gave me this picture. So I always say Stanford students are very resourceful. So actually there are 5 types of viral hepatitis. And people get confused because some are transmitted by contaminated food or water. So the easy way to distinguish them is A, B, C, D, E. A and E are transmitted by contaminated food and water. Basically, food and water contaminated by poop, from people who carry the virus. All right. A, almost all the children in California are sort of vaccinated against A. By the age of 16, they should all be vaccinated. So if you travel overseas, if you have not been vaccinated, you should get vaccinated against A because that's the virus you can actually get by eating in the streets and things like that. So you should all get vaccinated for hepatitis A. It does not cause liver cancer. It does not cause chronic liver disease, but it could make you very sick, and some people can die from it. E is also transmitted by food and water, but it's not common. It's only found mainly in certain parts of the world, some parts of Asia, in India, as well as China. And the major risk is pregnant women who get infected by hepatitis E. They have a high mortality rate. Now, B is the one I'm talking about. B is mainly transmitted by mother-to-child transmission. Whereas C is mainly by blood. So most C, which is more common in the US than B, is mainly caused by injecting drug use. If you use sort of IV drugs, for more than like 3 months, almost 50% of those people without a needle exchange program would become infected by hepatitis C. Hepatitis C also causes liver cancer. So what about D? You don't have to worry about D. If you don't have B, you don't get D. People only get hepatitis D if you have hepatitis B. So the best way to protect you against hepatitis B is get vaccinated. So how many of you know you've been vaccinated against hepatitis B? So if you don't know, you can always ask your doctor to do a one-time blood test for hepatitis B. And if you are not protected, you should get vaccinated. So it's one of these vaccines the CDC recommend if you travel overseas, you should get vaccinated against hepatitis B. Currently, there's no vaccine to prevent hepatitis C, but there's now curative treatment. If you, by just taking a pill a day for 2 to 3 months, you can cure over 99% of hepatitis C. We call hepatitis B a silent killer because most people with chronic hepatitis B have no symptoms. Because the younger you got infected, the less likely those children ever have any symptoms. Okay, so a lot of people in the world who have hepatitis B actually don't even know they are infected, including those living in the US. And even if you go and see your doctor, the doctor do your blood tests every year, including liver tests, they can be normal, even if you have hepatitis B, because some people with chronic hepatitis B, which has not flared up, their liver tests are normal, but they still run a risk of developing liver cancer. If you have hepatitis B, the risk of liver cancer increased 100 times. Right. And if left undiagnosed or untreated, as many as 1 in 4 will eventually die of liver cancer or liver disease. That's why we call it a silent killer. But eliminating the public health problem of hepatitis B is totally feasible because unlike HIV, we have a very effective vaccine for over 30 years now. And the vaccine in many parts of the world is very cheap. Only 3 shots, it can protect you potentially for life. And through safe injection and safe blood banking, you can prevent transmission by blood or in the healthcare setting. And even though there's no cure, you can really not totally eliminate, but largely sort of reduce the risk of death from hepatitis B by antiviral medications. These are very effective antiviral drugs which prevent the virus from making baby virus. And it's only a pill a day with virtually no side effects. And the good news is the patent for these effective drugs have expired. 2 years ago, if you buy the brand drug in the US, for 1 year treatment is like $12,000. Now the brand drug now in the US is down to $700 for 1 year treatment. And if you go to many parts of the world, it's down to $30 for 1 year treatment. Okay, so it's totally feasible to eliminate this problem. And also by educating the public that it's not transmitted by sharing food and drinks, you can eliminate the disease stigma. So what about the burden of hepatitis B in this country? We estimate there are about 1.3 million people living with chronic hepatitis B in this country, and about 2/3 of them have not been tested and are not aware they are infected. And every year, it's estimated there are 25,000 new cases in the US, largely due to migration of people already infected coming into this country. So hepatitis B is really, in the US, an imported problem. Okay. So who should be screened for hepatitis B? I usually, it's very simple to show these 2 slides. Were you born in a purple region? How many of you are born in a purple region? Okay. Okay, the next question is, were your parents born in a Jade region? How many of your parents were born in Jade? So all those who raise your hand should get a one-time blood test for hepatitis B, because that shows that you are at risk. And the good news is now covered by all the health plans by Medicare, Medicaid, due to years of our advocacy that changed the national policies. So actually, chronic hepatitis B is among the greatest health disparity in this country. The chance of a foreign-born Asian Pacific Islander having hepatitis B is 1 in 12. For US-born, in 1 in 70. For African American, this is also a big problem for foreign-born Americans. Right? And because this is CDC statistics, they didn't sort of separate foreign-born or US-born African American. Is 1 in 200. But if you are foreign-born African American, the risk is as high as Asian Americans. For Hispanic and white, this is not a major problem. The chances of a white person or Hispanic person having chronic hepatitis B is 1 in 1,000. And so even though Asian Pacific Islander represent only 6% of the US population, it accounts for over 60% of the burden of chronic hepatitis B in this country. And because hepatitis B is a major cause of liver cancer, you can see even though liver cancer is not very common in the white and population in the US, it's the second leading cause of cancer death for Asian men living in the US. So it's just, if you go to China, and Vietnam, many of the Asian countries, liver cancer is usually among the top 3 major cause of cancer death in those countries. So I just want to share with you my journey. I actually came to the Bay Area after living, working in the Midwest for 12 years, Minneapolis and then St. Louis, where we have very few Asian patients, right? So when I came, when I was recruited to come out to the Bay Area, I always said, my wife and I decided to come out to the Bay Area after living so long in the Midwest in search for better Chinese food. So what I found was, a lot of people who came to see me, dying from liver cancer or liver disease, if they were Asians, they were dying from a totally different disease than non-Asians. Okay, for non-Asians who need a liver transplant, mostly it's related to liver cirrhosis caused by hepatitis C or alcohol-related liver disease. Right? For Asians, it's largely, virtually all of them from hepatitis B. And what I was really sort of, which upset me was, no one was doing anything about it, right? And what's so sad is a lot of these people who came to see me had really advanced liver cancer, liver disease, and died from preventable death. And what we found, even through surveys and research, is we found most of the Asians living even in the Bay Area were not aware of the need for a screening. They did not know, even if they know they have hepatitis B, they did not know about the importance of regular monitoring and screening for liver cancer. And above all, doctors themselves were not aware you need to screen Asian Americans for hepatitis B. And many of them, even doctors at Stanford and UCSF in our studies, actually a lot of them don't even know what test to order to screen for hepatitis B and how to interpret the results and how to manage those patients. And there was a time when I came to the Bay Area, shortly after I came to the Bay Area, I found that, there was no national guidelines on hepatitis B screening. Hepatitis B vaccination for adults was not covered by health plan. Hepatitis B screening was also not covered by health plans. There was no national strategy to address this problem, either from the US Department of Health or CDC. There was no funding. There was no national or global initiative to eliminate hepatitis B. So shortly after in 1996, when I moved from San Francisco to Stanford, I founded the Asian Liver Center with a very ambitious goal towards global elimination of hepatitis B by addressing the gaps in national guidelines and policies, the gaps in research and also awareness. And in order to do this in my lifetime, we take on a strategy by, represented by CARE, building collaboration and partnership, evidence-based advocacy, research, education, and training. Because a lot of the time in academia is people do the research, but they don't do any advocacy, right? So if you want to translate your research into national policies, you need to go and talk to your congressmen, senators, and reach out to policymakers so you can translate those research findings into policies to benefit population health. So we first started when I started it was through a very generous donation of $50,000 from a Chinese American living in the Bay Area, Dr. C.J. Wong, who was an engineer, and we had no space. It just operated out from my office, and then after 20-odd years, we are very pleased now we have our own building on campus, so C.J. Wong Building on Welsh Road. We also 5 years ago established a regional center at Peking University, at the Stanford Center at Peking University. So anybody, if any of you travel to Peking University, do come and visit the Stanford Center. Is a beautiful building, and we welcome you to hold conferences there as well. So one of the major problems of hepatitis B is the lack of awareness. So we borrow a page from HIV. So instead of the red ribbon, we introduced the Jade ribbon. Why Jade? Jade in Asian cultures usually represent good health, good luck. And you can see our ribbon is not the loopy-loop ribbon. It's like the Chinese character, meaning people. So it's uniting people worldwide to eliminate hepatitis B. You see our ribbon color is pretty nice. So it's not that far from Tiffany's color. So the key messages of the Jade Ribbon campaign is get informed. 1 in 12 Asians have hepatitis B. 2 out of 3 are not aware of the infection. Get tested, get vaccinated if you are not protected, and get treatment, and make sure your doctors also screen you for liver cancer with at least once a year ultrasound. So even if you develop liver cancer, it could be detected early. And so I wear this Jade ribbon everywhere. I actually have one pin to every jacket I have, right? And so sometimes when I go through the airport, the security will ask me what that is, so I will take it off and give it to them and help, ask them to help spread the word of awareness. And we actually have some of the pins outside if you want some. And also we have jade bracelet too. I mean, it's not real jade, but jade is now getting very expensive. So what we did is, over the last 20 years, with every opportunity we have, we go out to educate the community. If you go out to the San Francisco New Year Street Festival, you will always see our 2 big booths with all kinds of games and surveys to engage the public to learn more about hepatitis B. We also periodically participate in the New Year sort of a street festival, and you can see our jade color dragon. It was featured in some of the newspaper because we we light up the dragon with LCD light inside the dragon, so it's very pretty at night. And for many years, we offer free screening. That was before the health plans started to cover screening. So we used to go out every other weekend, either in the YMCA in San Francisco or in other community centers. We offer free screening for the public, and also partner with San Francisco Health Department to offer a low-cost vaccination. So one of the major problems still is, now even though it's covered by health plans, a lot of the doctors are not aware. And even when we actually did a retrospective review of how Stanford is doing screening, we were only screening 1/5 of the people we should be screening, which is similar to a study done by Kaiser in Hawaii. They also found, they were only screening 1/3. So we give out these cards, take to your doctor cards. It's bilingual. It could be Chinese on one side, English on the other side, or Vietnamese on one side, English on the other side, to take to your doctors. So we want to empower the public to remind the doctors to screen the population at risk. So we also launched back in 2007 in partnership with San Francisco City of San Francisco. At that time, the mayor was our handsome Gavin Newsom, and Fiona Ma, who is now the state treasurer. Fiona herself has hepatitis B, so she was the poster child in Sacramento for hepatitis B, and actually. Gavin was a big supporter. In our outreach event, he took his shirt off and received a hepatitis B vaccine. He always gave me grief for making him take off his shirt in public, because it was on the newspaper the next day. And so we launched the citywide San Francisco Hep B Free campaign. 1 year, our slogan was "Be a Hero," stop Hep B. But then, we thought, good messages don't really get a lot of attention. So the next year, we launched a public awareness campaign which said, which one deserves to die? 1 in 10, 1 in 10, 1 in 12 Asians have hepatitis B. And because of that, it got reported by the New York Times and the media. So. Okay, so we also feel that in order to really get this campaign sort of disseminated, we need to engage the young people. So every year we host a youth leadership conference on Asian Pacific Islander health. And actually next week we'll be holding our 17th annual youth leadership conference, and where we accept 100, the top 100 applicants, high school applicants. There are many kids from California, some from other states, and actually some from as far as from China and even Germany. And they spent four days on Stanford campus to learn about what leadership is about, learn about Asian health disparity, and we hope we inspire them to eventually, no matter how successful they become, to remember the community, to give back to the community, and also help to raise awareness. And we've been very fortunate that a lot of these kids become inspired. So when they go back to the school, they form they call themselves Team HBV high school chapters. And many of them, when they go to college, they form collegiate chapters. So we have collegiate chapters in Harvard, MIT, as well as UCLA and many colleges. And so every year we meet in one of those colleges. So this year we're going to have our annual collegiate chapter meeting at Harvard. So usually we rotate coast to coast. So these are the kids who actually will help to spread the word of awareness and raise, to eliminate hepatitis B. So over the last, 20 years, we also, spearhead national efforts to change national guidelines and policies. We finally, in 2008, convinced the Office of Minority Health to declare hepatitis B a major health disparity in this country. And when I serve on the Board of Public Health at the Institute of Medicine, I convinced my board members to take on hepatitis B, and we released a report on national strategy for the prevention and control of hepatitis B and liver cancer in the country. And that led to the Department of Health and Human Services to release a national action plan, the first ever national action plan. And more recently, we also released a report by the National Academy on eliminating hepatitis B as a public health problem in the US. And as a result, that led to finally the ACA as well as Medicare and Medicaid to cover hepatitis B screening and hepatitis B vaccination for adults with no out-of-pocket charge. So, but it takes a long time to change policies. The lessons learned was, we even tried working with Mike Honda. We introduced a hepatitis B bill, like 12 years ago. And actually, we have both bipartisan House and Senate bill, but it didn't go anywhere. We tried Fiona Ma introduce legislation in the state assembly and to cover hepatitis B treatment, make it Medicaid eligible, and that didn't go anywhere. So my experience is getting policy changes with a bill is very hard because no one wants to spend more money, right? So, but changing national guidelines with evidence-based of information seem to have succeeded. So now I'd like to switch to what we have been doing in China. China actually has the greatest burden of chronic hepatitis B and liver cancer in the world. China accounts for about half of all the deaths from liver cancer each year. Now is about 400,000 people in China every year die from liver cancer, largely from hepatitis B, from untreated hepatitis B. And about a third of the people in China, a third of the global burden of hepatitis B are people living in China. In China, there are about 90 million people living with chronic hepatitis B, compared with about 800,000 people living with HIV. Yeah, but it wasn't really, addressed in China. So when I had opportunity, I was invited to give a keynote address at the National Conference on Prevention and Control of Viral Hepatitis in China back in 2004. I picked the title, Why Eliminating Hep B and Liver Cancer Should Be a National Priority in China. And at first, there was a little pushback from the organizer. And they thought, it seems very strong. Title is very strong. I don't know about whether the national government will like that. Right? But eventually, I'm glad that someone in the government actually liked my title. So I actually gave the talk and really highlight why China need to put resources to address this, because at that time, it wasn't even in the top 3 infectious disease priority in China. And everywhere I went to in China, when I talked to them, about hepatitis B, a lot of the provincial government would say, "Hey, Dr. So, why don't you tell Beijing it's not HIV, it's hepatitis B," right? And because, but they don't dare to, raise, raise that issue to the national government. So what I've been doing in the last 20 years in China is really advocating for a comprehensive approach to deal with hepatitis B by improving newborn vaccination, addressing the gaps in newborn vaccination, and now working towards eliminating mother-to-child transmission. Also advocating the government to provide free vaccination for unvaccinated children, and also in the more recent years to push the government, encourage the government to provide affordable antiviral treatment for the whole country, for those who are infected. As I said, there are estimated 90 million people with chronic hepatitis B, and at least 30 million needs to be on treatment. And until a few years ago, the estimate, like 3 years ago, was only 5 million out of the 30 million were on treatment. All right. And also, we really want to encourage the government to launch major campaign to eliminate disease stigma. So I had the opportunity to partner with the China Foundation for Hepatitis Prevention and Control, which is a nonprofit, but this is actually a government nonprofit. Their headquarters is in the China CDC. So I think China have this gold star nonprofit. There are very few. I think it's less than 50 or something. The other, China is otherwise very suspicious of nonprofit. So a lot of the government recognized nonprofit are basically run by ex-government sort of directors. So at that time, it was run by the ex-director. This foundation was run by the ex-director of the China CDC, right? So we actually formed a very strong partnership, and we went across the country to conduct education seminars to students, for healthcare workers. Here I was giving a talk to down on the far right to a minister of health who just came on the job to be in charge of immunization, and he told me he didn't know squat about hepatitis B. So I actually gave him a whole. By that time, I had developed an online training course in Chinese, so I showed him the course, but he wouldn't answer the questions. To advance, to move on the course, you have to answer all the correct questions before you move on. So I think he just asked his deputy to answer the questions. So China actually has made a major investment in vaccinating newborn. Okay, this slide shows, the upper red line is in 1992, before they launched a newborn vaccination program. By the age of 1 year, already 10% of those children has become chronically infected with hepatitis B, which put them at risk later on in life to develop liver cancer and liver cirrhosis. But only 14 years afterwards, after they introduced newborn vaccination program, though it was imperfect, they have already dropped the prevalence rate from 10% to less than 1%. And what we are doing with the Chinese government is really helping them to try to reach almost zero, totally eliminate mother-to-child transmission. So the China CDC estimated that only after 14 years of introducing this program, potentially it has prevented 20 million new chronic infection and prevented 3.5 million future deaths from liver cancer and liver disease. This is actually accomplishment. It's lauded as one of the most sort of significant public health achievement in the world. So now, even though China is doing a great job of vaccinating the newborn, there were a lot of, because it was not totally free for the public until 2005, there are a lot of young children, especially in the poorer provinces, who were not vaccinated. So we estimated that there were, millions of children. This is using their own China CDC data, that millions of children have not been vaccinated based on their surveillance study. So in order to advocate for the Chinese government to provide free vaccination, what we call catch-up vaccination for unvaccinated children. So at that time, I started raising money and started different parts of China to do sort of pilot projects to provide free vaccination. And so between 2005 to 2006, we provided free vaccination for 100,000 children. You can see, some of the schools, we designed these posters. One say 3 shots, okay for life, and the person in the poster is actually one of my Stanford students' boyfriend. So we are very frugal. We do all our design in-house. Okay, and then China CDC actually approached us and say, "Hey Sam, could you help Qinghai? Qinghai is a province northwest of China, just a little bit southeast of Tibet, and there's a lot of the population, probably over 40% of the population are minorities, Tibetan and other minority ethnic groups, and a lot of those kids were not vaccinated at birth because they couldn't afford the vaccine before, right? And so we went there and actually developed a catch-up vaccination program. Initially, we did a pilot program in 2006, 2007. We vaccinated certain districts, 56,000 children. And it was very successful. And the Qinghai government said, "Hey, Sam, could you help us vaccinate the whole province?" So I thought, that's about another 500,000 children there. So thanks to a very generous donation from a retired Silicon Valley executive, high-tech executive, he donated $1 million. And we actually, in partnership with the Qinghai government, we vaccinated all unvaccinated children in the whole province. And so that involved, and that was the first program the Chinese government allowed a vaccination at the school. Usually the kids have to go to the CDC office to get vaccinated. And this is the first program they allow us to conduct the vaccination at school. So there was, we had a 99.4% 3-shot completion rate. It covered 2,200 schools. And in order to convince the Chinese government, even though that was very popular, we actually launched the project from People's Congress Hall in Beijing. And at the end of the conference, the Qinghai government was going to, they wanted to give us an award. I said, "Don't give us an award. Give Beijing government an award." So they would take ownership. Okay. So in addition to that, we actually did a cost effectiveness analysis for the Chinese government. We said, if you vaccinate all these unvaccinated children, it's actually going to be cost saving. Okay, so together with the really sort of a good publicity from the Qinghai campaign and the cost effectiveness analysis, the Chinese government, we were very happy that they adopted our recommendation. And for the subsequent 3 years, they launched a 3-year free catch-up vaccination program across the country, which actually benefited 17 million children. So we were very happy because that was our ultimate goal, is to have the Chinese government take ownership. So in the last couple of years, we've continued to work with Qinghai government as well as Gansu government. Gansu is just next to Qinghai, also a lot of minority population. It's one of the beginning of the Silk Road. So if you go to, you go on Silk Road, you're bound to go through Gansu province. And so, you know, once again, in Gansu Qinghai, there was a lot of, a lot of the healthcare workers are not really very knowledgeable about hepatitis B and liver cancer. So we actually use our online training course to train all the healthcare workers, and the government the healthcare workers, if they completed the course, then they get credits, CME credits by the government to encourage all of them to take the course. And also we also launch a program to educate all the pregnant women. You know, in China, I don't know whether you know, in many places in the cities, if you want to raise a family, you have to attend these talks, which is run by Maternal and Child Health, CDC, you know, teach you about, you know, how to, the public health issues, you know, all the issues about raising a family. So if you don't attend, if you did not complete the course, you can't really, I mean, there will be consequences like coverage for school and may not be covered by the local government. So if you want a family, raise a family, you need to complete the course. So we found that was a huge opportunity to introduce Hep B into that sort of family planning type of a curriculum. We try to reach out to the Chinese Women's Association, but they wanted money. So we you know, we are very frugal. We don't want to. We want to partner with people who are passionate and not because of money, right? So that actually turned out to be very good. So. These show some of our the ways we educate the public. We have cartoons both in Tibetan and Chinese, educate the public about hepatitis B. We have the Qinghai government was very creative. They even have freeway signs, which educate the public. And when you go through the toll booth, you might see our Jade color sign, you know, educating people about hepatitis B, and they reach out to the minorities, working with the religious leaders, and you know, actually, I was amazed that there are certain parts of China have such a major Muslim sort of presence. I mean, you know, you go to Gansu Qinghai, there are these humongous mosques, and when I go to these rural areas, I don't know, 5 o'clock, you know, they start us praying, and you know, wake you up in the morning, you know, with these Muslim prayers, you know, and some villages are all Muslim population. So the other thing was discrimination. So I don't know whether you know this. You know, for many years in the past, if you have hepatitis B, you can't even, if the school knows you have hepatitis B, they will use all kinds of excuses. Okay, one, they would not take you. Secondly, they would use any excuses to sort of dismiss you from the school. And companies used to always require Hep B testing before employment. And if they find you have hepatitis B, they would not hire you. Or if they know you have Hep B, they will fire you because of they believe that you can actually spread the infection by you know, eating in the same canteen and working together. So back in 2003, we had this very brave young man in the middle who sued the provincial government for job discrimination. He was supposedly accepted for the job, but when they found out he had hepatitis B, they would not hire him. So I was reached by the advocates in China as well as the China Foundation and said, "Hey Sam, could you write to the judge about, you know, there's no grounds for not hiring someone because of they have hepatitis B. So I wrote to the judge, and he became the first man who won a case against China for Hep B discrimination. But 2 years afterwards, when I saw him in China, he still didn't have a job. But I think things have changed since that time. So the other opportunity was I was asked to submit a letter to the mayor of Suzhou to convince the government to ban Hep B discrimination in the workplace. And so actually Suzhou became the first city in China to ban hepatitis B discrimination. And the really major sort of opportunity to change the national sort of policy about hepatitis B discrimination came in 2009. I was actually very surprised because, at that time the Chinese government said they were proposing this policy to ban hepatitis B testing for admission to kindergartens. Okay, so and they actually have a period for public comment. I didn't know Chinese government allow you to make public comment before they release a regulation. So I actually got together with my friend from WHO in Beijing. I said, okay, let's write to the Chinese government and said, don't stop with kindergarten. It should be across the board, both in admission to any school as well as employment. And so actually we were very happy. I don't know whether we play a major role in that or not, but the Chinese government in 2010, for the first time, not only the health department, education department, I think the labor department, they released a joint declaration to ban hepatitis B discrimination for in both in employment as well as in school, and also make sure that the test results are kept confidential. Before, in the past, if you test positive, the company release your data. So you cannot not actually find a job in another place. So that was a major problem. So in the old days when I actually went to China to talk to these folks with chronic hepatitis B, they were so concerned that they would be discovered. We meet in coffee shops, and it's like, it's not espionage, but it's like, because they just worry. Some of them are doctors and lawyers, and they pay people every year to do the blood test for them, so they would not be discovered, right? So, as part of this effort to eliminate job discrimination, we also launched a initiative in the last 5-6 years, working with companies to make sure we have an all-inclusive workplace without discrimination. So we work with companies like Lenovo, Intel, Microsoft, Apple, to educate the employees, as well as make sure they eliminate all discriminatory policies. Because we knew that before there were companies, actually all their suppliers discriminate. Like at one time, HP supplier discriminate, Apple, Foxconn were discriminating. And so actually we work with those companies to eliminate all that discriminatory policies, and also educate the public so they don't worry about working with people with hepatitis B. So we also actually spend money in China on major public awareness campaign. This was one back in 2004 and 2016 in the Beijing airport to sort of spread the word that it's not transmitted by casual contact or sharing food. We also motivate work with students. We motivate university students in China to form sort of Team HBV to go out and educate the public. And these show some of, every year we actually provide some funding for the best of proposals, and we fund some of these university groups to raise awareness in the local community. And every year, just like now, if you go to Beijing, you see our huge public service, awareness campaign in the subway. The 2016, 2017, the last few years, we have videos and in all the trains, in certain routes in the metro system in China, with 100 and also 168 subway stations. I think this year we actually have even more subway stations and trains. And usually we have videos as well as electronic billboards to raise awareness. And we partner with the WHO, Beijing CDC, China CDC in these efforts. Once again, in the summer, World Hepatitis Day is a good opportunity to get the community involved. And every year we engage university students who are going to the rural area to educate the community to include hepatitis B in their messaging. And another actually more creative way is we found that, in the past, there's only like a total of 3 nonprofits in the US, including us, who does hepatitis B awareness work. There were hundreds working on HIV, but only 3 on hepatitis B. So we actually engage nonprofits and give them a starter kit and to include hepatitis B in their outreach educational efforts. So finally, I want to just touch upon, our most recent effort is to really encourage the government to provide effective antiviral drugs and not just herbal supplement for hepatitis treatment, right? So a few years ago, I was asked to chair this technical consultation organized by the World Health Organization and the Chinese Ministry of Health to really gather the evidence and put forward a sort of a argument that Chinese government should really invest in hepatitis B as well as C treatment. So after the 2-day conference, we actually had a high-level sort of presentation to the leadership in the Chinese government, and they were very supportive. Except my concern was at that time they were very concerned about the cost of the antiviral medication. So because of that, when I came back to Stanford, so what we did was we actually did another cost effectiveness analysis, and basically, the way we did it is actually show the Chinese government, if you actually can acquire the drug at this cost, within this range, it'll be cost saving. Within this range, it could be highly cost effective or cost effective. And basically, in a way, we give the evidence for the government to negotiate with the drug company. So actually, they did exactly that. So they negotiated with GSK and actually got a 67% reduction in the drug cost, which fell into our analysis as highly cost effective. So now the treatment is no longer an obstacle. And actually the cost has dropped even further. And as of this year, the Chinese government has procured the generic version of this drug I think it's only about $35 for 1 year treatment for 10 cities. So they're rolling it out in 10 cities, and hopefully that will scale up in the next 2 years to across the country for that low cost drug. And so we are very committed to not only addressing eliminating hepatitis B and liver cancer in China, but we also work with other countries. We work in Mongolia, in Vietnam as well, allow us to really try to inspire the government to do more and invest in hepatitis prevention and control. There's now, when I first founded the Asian Liver Center back in 1996 with a goal of global elimination, people thought I was crazy. How could you eliminate such a big problem, affect so many people in the world? But fortunately, it turned out I wasn't that crazy after all. So, because in 2016, the World Health Organization released the first ever global health sector strategy to eliminate hepatitis B and C by 2030. So it's actually now under the UN Sustainable Development Goal of 2030. And so now we have targets for elimination, increasing treatment, increasing vaccination. And so we are reviewing every year how the countries are doing. But once again, a major obstacle is making sure that the countries invest in treatment. And to increase the capacity of the public health system in many of the countries, in hepatitis prevention and control, we also have developed online training courses for healthcare workers, which are now, you can take it anytime for free on our Stanford website. Is now available in English, Chinese, Vietnamese, and Mongolian. So I gave an interview to this is China Newsweek back in 2007. And the title is Eliminating Hepatitis B and Reducing the Burden of Liver Cancer in China is not a dream. And it is actually becoming a reality. But it needs significant sort of government commitment to make this happen. That at that time when I was interviewed, it was only, 12 years ago. In order to interview me, all these newspaper reporters need the government approval. Yeah. I'm glad and actually in that article, I actually disagree with the priority of the health department. The health department was going to invest in research for a curative hepatitis B vaccine, which I know is not. It would not be successful. And to this day, there's no curative vaccine. And I emphasize that they should be putting the money on improving prevention, vaccination, and also later on treatment. So finally, every year we engage celebrities to raise awareness, and this was one done by Jackie Chan and in both English and Chinese. The Chinese version is much better. His English is not as good. But anyway, I just want to share with you a message from Jackie Chan, because this Sunday is World Hepatitis Day, July 28th. And if any of you are in the city at 8:30, we're going to light up San Francisco City Hall Jade color. Okay? It will light up at 8:30. So if you want to come and do a photo op with our activists, come to in front of San Francisco City Hall on Sunday. Could you start that video?
Hello, I'm Jackie Chan. July 28th is the World Hepatitis Day. Do you know hepatitis B is the major cause of liver cancer? Hepatitis B is both preventable and treatable. Hepatitis B is not transmitted by sharing food, or kissing. Do not let hepatitis B keep you away from the people you love. Join Jade, stop hepatitis B. Stop liver cancer. Okay?
Okay, thank you very much.
Okay. A hero. The words I took away began with evidence. You're a scientist, and you say, we're going to start with evidence. And that, of course, is important for vaccine and all of those sorts of things. And it's why people listen to you, is because you are this world figure with regard to this disease. But you've chosen to be an advocate, right? And you also understand bureaucrats need to know that this is going to be cost effective. And one of the things that we've seen, the World Bank and others, is they've done estimates on how pollution hampers economic growth. And I'm curious, with 90 million people affected, 30 million requiring treatment, that I don't know if you've come up with some sort of estimate of what that does to growth. And this is maybe a cold-blooded way of talking about this, but their lost years of productivity, these sorts of things. I don't know if that's factored in, if that's a consideration.
Yeah, so when we basically, the estimate is if China doesn't, from the health impact point of view, if China doesn't do anything, the data we have with WHO is in the next 10 years, another 10 million people will die, right? The cost part, I mean, we do analysis in terms of healthcare costs, right? But we actually don't have enough data on the social cost, social economic cost, right? So that is a little harder to come up with. But the healthcare costs, we also release to them, and also how much money you will save in terms of future healthcare costs, which are all increasing in China, right? So I think the important thing is not with the evidence, you need to do the extra effort to reach the highest level possible. That means you have to, I'm not good in karaoke, but a lot of these leaders like to sing, right? And then actually, and also in the old days, you need to socialize with them, right? And I drank a lot of 白酒, white wine.
白酒啊.
And because
so you put your own liver at risk.
Because you know, when you first sit down, let's say with the leadership in a banquet, it's, you know, these humongous table, and each of them, all the staff will come and
one by one
toast you. And in Qinghai and Gansu, it's not one glass, it's 3 glasses, right? So, but if you can train your liver, within 10 minutes, you become best friends with all of them, right? And so, yeah, I finally, I was with China CDC to a different province, and they served me some local brew white wine, and that got me really sick. So ever since that time, I don't touch the white wine. I say a little red wine is okay, but no.
So he's got the Jade, a ribbon. He also deserves a Purple Heart for that. But so you have to befriend and you have to cultivate and educate, right? I mean, so evidence and then education has to be a part of that advocacy. You you didn't, you had success in the United States, you went there and you did these kinds of things. And you talked about having to overcome discrimination and also, bureaucratic lethargy and these sorts of things. And even people at the top of the health ministry had some convincing to do and some education and that sort of thing. But the wider education with regard to the anti-discrimination efforts involving Jackie Chan and all these other folks, there are 1.3 billion who don't have hepatitis B, but need to know about hepatitis B.
Yeah,
And
so
the reducing fear part of it.
Yeah, not only, even though there are these new laws, but the fine is so little. So we still have to continue to spread that message every year, so people will feel at ease. Because when we do these, when we survey healthcare workers in Asia, not only China, in Vietnam, we find the same problem persists with healthcare workers. Like doctors think, oh, maybe you shouldn't eat with someone with hepatitis B, and they perpetuate the misconception. And when I go to some provincial sort of areas, I find the brochure. I always collect all what do you have on hepatitis B. I always look at it, and sometimes they spread the misconception. So in one city, in one township in Qinghai, they said it could be transmitted by mosquitoes. I said, no, we better take that off. And then there are some which, in other province on the East Coast, which is much more prosperous province, they have some brochure saying, don't share cups and eating utensils. So some of that misinformation is perpetuated by healthcare workers, So you have to overcome that, and I think the celebrities are great to help, because a lot, we had celebrity spokesperson with like 90 million followers or whatever, right? These, actually, Jackie Chan is not very popular in China. So, he's too old, right, for the Chinese public.
Right.
The young people, so we use these,
Influencers.
Yeah, right. They are actresses and actors with huge followers and popular in the soap operas or whatever. And so, the one we're using this year also is a young person. And he's featured in a lot of the shopping malls, posters. So you have to use those people to reach the public.
Yeah, but being in subways, being in the airport, being all of this, touching people, clearly having an impact. And online activism, actually the hepatitis B is maybe the first successful case of online activism. You probably know Guo Binyang, who's written about that. But that came from bottom up as opposed to outside in, the education. We have time for a couple of questions. We have 1 minute for questions. So quick questions, quick answers, right? Wait for the mic, please. Okay. Thank you, Stuart.
Thank you. I'm just wondering, in terms of opposition to what you've been trying to do either in China or in this country. We're hearing a lot in other areas about anti-vaxxers and people who just don't want to listen to the research or the science. What have you found in terms of the folks who are actually opposed to these things, or is there a significant element?
I think for China, there isn't much of this problem. The concern is, their skepticism is domestic vaccine. Domestic vaccine, okay. So if you say if they get vaccinated for hepatitis B and they have no objection. They know the risks of hepatitis B and liver cancer in China. So they are very receptive. The only thing is they sometimes do worry about the government vaccine is domestic vaccine, and periodically, just recently, last year, we have these scandals, right? And that the vaccines were not well stored. Basically, that that wouldn't hurt the person. That the baby just need to be revaccinated, right? Because if it's not well stored, it may not be effective. It doesn't really do any harm. But so, some people would rather pay more to get a foreign vaccine. I mean, that happened in Vietnam. To this day, is a big problem in Vietnam. Yeah. In this country, because we say is, the Hep B vaccine is actually known as the first anti-cancer vaccine, all right? So because it prevents hepatitis B, which causes liver cancer, right? So when we on the internet, there were some people who tried to attack us for promoting vaccination, but after a while, they stopped. I don't know why, because we are addressing mostly in the Asian community. Maybe that's why they left us alone.
Dr. So, the last time I heard you was at the Asia Society in San Francisco, I think a year ago, and you were about to head towards Mongolia that evening after our presentation, or your presentation to us. How is that program going?
Okay, actually, I'm going to be spending another 2 weeks in Mongolia. Starting the last week of August, to evaluate. We are part of the group team from WHO to evaluate how they're doing in terms of progress, because Mongolia has set a very ambitious goal. They want to test 80% of the adult population for Hep B and C by 2020, and also provide treatment for those who are infected. 80. But their population is small.
3 million.
They're 3 million, and then half of them are young people, and so they could do it, and they have access to very low cost generic medications. Yeah.
One last question.
Dr. So, you mentioned that the hepatitis B virus was first discovered among Australian natives. I'm curious as to whether certain ethnic groups are more prone, maybe genetically, to contracting the hepatitis B virus.
No, I think that's a common, good question. That currently we don't have evidence that ethnic groups are more prone to get infected, but there are different genotypes of the virus, different hepatitis B virus. The virus in Asia, the women who get infected with that virus, they tend to have very high viral load. Okay, the more high viral load you have, the higher the chance you can transmit the infection during the birthing process to the newborn. Whereas the viral load of people infected in Africa is much lower. So the mother-to-child transmission risk in Africa is, even for those women infected, is lower than those women in Asia.
So, go ahead.
So there are geographic differences of the virus, itself.
Not just one, but the point of all of this is, of course, this is a global concern, and the disease is globalized. The answers need to be as well, and we have to really celebrate the kind of collaboration that Dr. So has initiated here in the United States, but with partners in China, and we need more of this, not less. Ladies and gentlemen, I've learned a lot. How about you?
Thank you very much.